Our medical correspondent here at KTN News, Dr. Masi Korir, now joins us in studio to discuss this very scary virus in the country currently. What is the status?
Okay, well, in Kenya, there are two counties and two sub-counties, actually. Trans Nzoia, that's Kitale in Trans Nzoia, and West Pokot, that there are two areas or two compounds that have been isolated and quarantined for the suspicion of Marburg. This is following the case from Uganda who had actually traveled to Kenya to look for a traditional healer or a herbalist because of the symptoms he was exhibiting that were suspected to be Marburg. And so because of having come in contact with this person, those areas have been cordoned off, they've been quarantined, and the next step is actually to just confirm that those people are not infected by the viral disease, and two, to monitor them for the next 21 days that they don't develop any symptoms that would be suspicious of Marburg. So the Ministry of Health, I talked to the Director of Medical Services earlier. They have a rapid response team in the two counties, that's West Pokot and Trans Nzoia, who are on the ground together with the teams from the county government to just do surveillance and monitoring on these contact persons that came into contact with that person from Uganda and also other people. And they're also calling on other people who may have come in contact with this person from Uganda to actually report to the nearest health facility or to these rapid response teams at the counties so that they are able to be monitored and tested that they didn't contract the virus. Unfortunately, from discussing earlier, this person went back to Uganda and has since passed on. And it is highly probable that they had the Marburg virus disease.
So even as we talk about this, viewers would be wondering, what really is this Marburg disease? Or what are its symptoms? How is it transmitted? Just give us an overview of that.
Okay, well, Marburg virus is in the same class of virus as Ebola. And the symptoms of this is fever, very high fevers. People feel lethargic, some get into vomiting. And at the late stages now where we start seeing bleeding from openings in the body. And so the symptoms sometimes are confused with malaria, and that's why the first person actually who was reported in Uganda had been treated for malaria, and when they were not responding to malaria treatment, they were then transferred to another referral facility. But he since passed on, and now having passed on from there, the sister developed these symptoms also, and she died. And when they took the samples, now is when the Viral Research Institute in Uganda confirmed that she was positive for the Marburg virus. So these symptoms may confuse with malaria because, well, the fever, the lethargy, the pains here and there, many people would think it's malaria. But now that there's a high alert in eastern Uganda, the Queen District, and the western part of Kenya, anyone developing these symptoms should really just seek help at the nearest health facility. Now, the incubation period for this is between 2 and 21 days, and it has a very high fatality rate. That's between 24 and 90% of the people who would be infected would probably die if they are not attended to earlier. And the treatment for this, really, there's no treatment for the Marburg virus. Unfortunately, there's no vaccine for it. So what the medical personnel or the medical practitioners would do is to treat the symptoms that the person shows up with. So if it's fever, they'll manage the fever. They'll do rehydration. They'll put somebody under fluids so that they really keep them going so that the body can fight this disease.
But even as we talk about it now being in the county of Trans Nzoia, what would be advised for the residents as far as prevention is concerned? What should they be looking out for?
Okay, for those two counties that have been mentioned, okay, it's these two counties, Trans Nzoia and West Pokot, have been mentioned because the contact person from Uganda was in these two counties. But then the entire western region of Kenya, and anyone really coming to Uganda who gets in contact with anyone, that is the first. That's the first point where if somebody is coming from Uganda and they develop these symptoms, that's the first sign that, well, all may not be well. And two, people should avoid close contact with bodily fluids and bodily tissues from people who are suspected to have Ebola, because the transmission is from contact with this person.
Yeah.
And like Ebola, the burial rituals that some communities go through sometimes really predispose these people to contacting the infection. And then for the healthcare workers, they do personal protective equipment where they double glove, they wear 2 gloves, they have masks and goggles. They're really well protected, like what we used to see during the Ebola outbreak. So it's really about preventing contact from the people who are infected. Now, prevention of contracting the disease from the source, people get it from what we call fruit bats, and they mainly live in some of these caves. Now, it's interesting to note that the first person who was suspected of Marburg in Uganda was a game hunter who was coming close contact with some of these caves where it had a lot of bats. So that's where the first contact is. So people are advised to avoid bats and non-human primates. That's now the monkeys and the baboons. Yeah. So don't come into contact with this so that you stop cross-infection with the Marburg virus.
Should the country be on high alert over this?
Oh, definitely, because we are in close contact with Uganda, and it's not the first time that Kenya has actually has been on high alert. Yeah. In 1980, that was the first reported cases of Marburg, where 2 people were reported of Marburg and 1 person died. So it's not the first time that Kenya is on high alert for Marburg, because it's on this belt. So Kenya has reported Marburg before, Uganda, Angola, DRC, and the first ever case of Marburg that was reported was in Frankfurt, Germany, and Belgrade, Serbia, where from a laboratory where they're using monkeys from Uganda. So this region and this belt is actually at high risk of the viral infection. And so the main thing really is just prevention and early detection and monitoring. And anyone who has come in contact with somebody from Uganda who has these symptoms should report to the nearest health facility. And I'll just chip in very quickly and say it's unfortunate that the nurses are now on their 152nd day of strike. So I'm hoping that in some of these areas where people are being told to report to the nearest facilities, that they'll actually find some of these facilities open. So in an area where a facility is not open, anyone who suspects Marburg should report to the county government health department. Then from there, the rapid response unit teams from the Ministry of Health will be able to handle it from there. But hopefully, the nurses' issues will be sorted out. I'm told there are some that have started going back to work and some have been recalled back to work because of this. Over the last 3 months, we've been experiencing some upsurge in some diseases, and now we are on high alert on Marburg. We are on high alert on the plague from Madagascar. So really, our healthcare needs to shape up soon before we get something that we cannot handle. But right now, all measures are being put on place. There's a cross-border meeting between the ministry in Uganda and the ministry in Kenya just to monitor the situation. So far, 2 people have died. Then actually 3 people have died, and then 2 are suspected cases who are now the health workers that had come in contact with those 3 cases. And so we hope everything will be under control.
All right, and the country continues to be on high alert on the Marburg virus. All you need to know about that particular virus there from Dr. Mercy Korir. She's our medical correspondent here. Dr. Mercy, thank you.